Is a 33-year-old Caucasian female with a chief complaint of headache, sore throat, cough, and facial pressure, which she's had for 4 days. History of present illness. The patient was in normal state of health until 4 days ago when she began to have nasal congestion, cough, headaches, low-grade fever, and sore throat. She's tried Mucinex DM for the last 4 days to alleviate the congestion without success. Review of systems per patient report. Neuro, no syncope, loss of consciousness or dizziness. Cardiac, no shortness of breath, chest pain, or heart palpitations. Pulmonary, no shortness of breath, wheezing, coughing up blood. Gastric, no nausea, vomiting, diarrhea, constipation, or abdominal pain. No dysuria or frequency. No rash or urticaria, and no polydipsia, polyphagia, or polyuria. Her past medical history include Gravida 1, Para 1, abortion 0, no complications during pregnancy or delivery, which resulted in a term pregnancy. She does report seasonal allergies in the fall and spring and an ovarian cyst in 2010, which resolved without intervention. She was treated with macrobid in 2012 for a UTI. Her past social history includes denial of tobacco, alcohol, or recreational drug use. She's been married for 5 years and has a 2-year-old boy. She is allergic to sulfa drugs. Her current medications include orthotricycline, which she takes 1 POQ day for contraception. On physical exam, her vital signs were temperature 99.8, respirations of 16, pulse 68, blood pressure 122/64, and pain 2 out of 10 in the facial area. She is a well-nourished female with cough who looks fatigued without acute distress. HENT, normocephalic with facial tenderness upon palpation. Bilateral ears have TM effusions. Pupils are equal reactive round to light with accommodation bilaterally without erythema, edema, or exudate. Her nasal turbinates are mildly erythematous without lesions. Her throat is mildly erythematous without exudate. Uvula is midline with 2+ tonsils without crypts. Her mucous membranes are moist without lesions, and she has good dentition. Her neck and lymph nodes, no lymphadenopathy, supraclavicular or cervical. Her thyroid is soft without nodules. Her chest is symmetrical bilaterally with no wheezes, crackles, rhonchi bilaterally. Her cardiovascular system, she has 1+ radial pulse, prominent PMI over the 5th intercostal space, midclavicular line, which is a regular rhythm and rate, normal S1 and S2. Her neuro exam includes cranial nerves 2 through 12 intact. Her primary diagnosis is sinusitis with a differential diagnosis of strep throat and pneumonia and influenza. We did a rapid strep test, which was negative. Chest x-ray, PA and lateral was clear with no evidence of pneumonia or mass. Rapid flu was negative. Our treatment plan is Levaquin 500 milligrams POQ day for 10 days for sinusitis, Vicodin 5 milliliters POQ 4 to 6 hours PRN cough, a Decadron 8 milligram IM shot for today, and continue the Mucinex DM 1 POQ day for 3 days for nasal and sinus congestion. Thank you.